And talking about the dropout, what are the primary factors leading to dropout and how to prevent it?
Yeah, so there are some which are, the most easy to kind of change on the PT practice's end. The number one thing there is the home exercise program. 72% of patients don't do their home exercise program. So that's a big opportunity right there. Like, obviously, if somebody's not doing their home program, they're not getting better to the rate that they could, if at all. And then if they're not getting better, then of course they're not going to come back, and that's going to be a issue right there. 74% of patients are frustrated with the onboarding process of going to a clinic, and the no-show rate, that's also a very high one there. And with patients want simplicity. 68% of patients want the ability to book appointments on their phone. So things like that, making it as simple as possible for patients to book their next appointment, that may be the difference between them dropping out and not. If it's something that, they have to call in, and then once they're called in, they're put on hold, or maybe they don't get an answer and they have to call in again or something like that. Sometimes that may be the difference for a patient. They may, say, oh, okay, I'll have to call back. They may forget. And then, then it's been 2 weeks. Maybe they're not as motivated. So simplifying that process as much as you can. Things, of course, like scheduling patients out from the beginning. That's a big help. If you can do an online scheduling system, we partner with a company called Better Healthcare, which allows patients to book appointments directly online that will integrate with the EMR system. We allow people to book appointments from our mobile apps. Things like that can just make it as easy as possible for patients to book appointments. Those are really big. As far as dropout, setting expectations is really important. For patients, this is a big thing. Obviously, everybody, we all do go through the goals with patients at the beginning. Setting realistic goals that are measurable and you can kind of track them over the course of their visits. That can help show people progress, and then, actually motivate them and make them realize that even though, they may still be in pain, now they can move their shoulder a bit further than they could at the beginning. And that's like an objective thing. So that's another piece there, as well as just connectivity in between visits. So right now, if you think about a kind of normal physical therapy course of care, somebody will come into the clinic and then, they're with Mariana. They're like, hey, you're walking them through the exercises. They're much more engaged. They're much more connected with their provider and able to kind of seek the instructions they need. But once they're at home, they don't have the same level of feedback. They don't have the same level of support. And if they don't have a way of, in between those clinic visits, sending their PT a message and saying, hey, like, I forgot how to do this. Do I, do it like this, or should I be doing it through pain? Things like that. If they don't have that ability to reach out, then they may just stop doing it. They may not improve until the next visit. That's a massive impact on their improvement levels. And of course, like I mentioned, failure to do home exercise programs, that's the number one cause of dropout, because that's what their progress is. It's all based on their ability to rehab and complete their home exercise program so that they can actually solve the problem. So that's always the number one place to start.